so a Monteggia fracture is a proximal ulnar fracture and radial head dislocation. So patients will normally be splinted. They can be in a long splint with the elbow immobilized and the wrist also. But these patients are more than likely going to have surgery for surgical reduction and fixation of the fracture. But following immobilization, you will see the typical restrictions with elbow flexion and extension, and also in the wrist, and then forearm supination and pronation as well. The study that I found just looked at gaining flexion and extension, and so they used joint mobilizations to gain that following immobilization when it was safe. So they did humeral ulnar and humeral radial joint mobilizations to increase flexion and extension. For flexion, you can have your patient laying down, and you'll do the scoop method where you apply distraction on the ulna and then get the olecranon to come out anteriorly. So it'll just be like this. The study did 7 to 8 minutes of joint mobilization, but before that they did pulse shortwave diathermy to the cubital fossa of the forearm, and then also you can apply the radial head mobilization both anteriorly and posteriorly.